Hello learners, welcome to my channel Psychology. Today we will learn subfields of psychology. Today we will learn about clinical psychology, developmental psychology, cognitive psychology and social psychology. Clinical psychology comprises the study and application of psychology for the purpose of understanding, preventing, and relieving psychologically based distress or dysfunction, and to promote subjective well-being and personal development. Central to its practice are psychological assessment and psychotherapy. Although clinical psychologists may also engage in research, teaching, consultation, forensic testimony, and program development and administration. Some clinical psychologists may focus on the clinical management of patients with brain injury. This area is recognized as clinical neuropsychology. In several countries, clinical psychology is a regulated mental health profession. Now, now developmental psychology. Developmental psychology mainly focusing on the development of the human mind through the lifespan. Developmental psychology seeks to understand how people come to perceive, understand, and act within the world, and how these processes change as they age. This may focus on cognitive, affective, moral, social, or neural development. Researchers who study children use a number of unique research methods to create observations in natural settings or to engage them in experimental tasks. Such tasks often resemble specially intended games and activities that are both enjoyable for the child and scientifically useful. And researchers have been devised clever methods to study the mental processes of infants. In addition to studying children, developmental psychologists also study aging and processes throughout the lifespan, especially at other times of rapid change, such as adolescence and old age. Developmental psychologists draw on the full range of psychological theories to inform their research. Now it's cognitive psychology. Cognitive psychology studies cognition, the mental processes underlying mental activity, perception, attention, reasoning, thinking, problem solving, memory, learning, language, and emotion are areas of research. Classical cognitive psychology is associated with a school of thought recognized as cognitivism, whose adherents argue for an information processing model of mental function informed through functionalism and experimental psychology. On a broader level, cognitive science is an interdisciplinary enterprise of cognitive psychologists, cognitive neuroscientists, researchers in artificial intelligence, linguistics, human-computer interaction, computational neuroscience, logicians, and social scientists. Computational models are sometimes used to stimulate phenomena of interest. Computational models give a tool for studying the functional organization of the mind, whereas neuroscience gives measures of brain activity. Social psychology. Social psychology is the study of how humans think in relation to each other and how they relate to each other. Social psychologists study such topics as the influence of others on an individual's behavior and the formation of beliefs, attitudes, and stereotypes in relation to the other people. Social cognition fuses elements of social and cognitive psychology in order to understand how people process, keeps in mind, or distort social information. The, the study of group dynamics reveals information in relation to the nature and potential optimization of leadership, communication, and other phenomena that emerge at least at the microsocial level. In recent years, several social psychologists have become increasingly interested in implicit measures, mediational models, and the interaction of both person and social variables in accounting for behavior. The study of human society is so a potentially valuable source of information in relation to the causes of psychiatric disorder. Some of the sociological concepts applied to psychiatric disorders are the social role, sick role, social class, life event, culture, migration, social, and total institution. Thank you for your love and support.